Okay, so I wanted to record a quick video here for people who might be in the market for a therapist, or for those who are struggling with an issue, you're considering different options, you're starting to think about the idea of going to therapy, but maybe you don't really know what that would look like, what to expect from going, what is the process like? Or for any sort of questions or thoughts along those lines. I've found just with time that, I've heard from a lot of my clients that it's just really hard to know what you're looking for. I think there's a lot of weird ideas out there about what therapy is really like, the role that your therapist is supposed to play for you. So my hope is I've got 5 different points here, and I'm going to go over them, and hopefully you'll feel a bit more informed about the process by the end of this video, and what's normal to expect. Yeah, so let's get started. First and foremost, I would say that at least, the way I was trained and just the way that I view therapy as a whole is that it is not a place for advice. That is not my role, to give you advice about how to handle certain situations in your life. I've had plenty of people come in, kind of with a do I, don't I question. Do I stay in the relationship or I leave it? Do I quit this job or do I look for another one? Do I accept the, internship wherever? Therapy to me is about learning how to feel confident in your ability to handle these problems on your own. So that's my role, to help you figure out what's best for you. I'm just not going to tell you one way or the other. One, because I don't think it's fair to you. I think in the long run, like I said, to me, by the end of this process, you should feel comfortable knowing that, okay, if something hard like this comes along again, or I have tough decisions to make, that I know myself well enough now that I can answer this question on my own. Along those lines, I very much feel that therapy works when you and your therapist, counselor, psychologist, whomever work together. And that may sound like really obvious, but I've been surprised at the number of clients who have come into me saying, I've worked with people in the past and it felt very much like an expert, not expert relationship. And don't get me wrong, obviously, we've been through school, we have the training, we have an understanding of this process and how this stuff works. But I tell all of my clients up front, I need to know how this is going for you. So if I say something that sounds not true to you, or just rubs you the wrong way, or we're focusing on things that feel irrelevant to what you came in for, or something just really isn't clicking for you, I want to hear about it. In fact, the more feedback, the better. That helps me to figure out, okay, I'm so glad, I felt like something was off too. Now we can kind of reassess and pick a new direction. I really think communicating about that stuff can make or break your treatment, for sure. Let's see here. I guess also along those lines, this would be point number 3 to consider. And I think a lot of other therapists as well, operate under the assumption that we call it the relationship heals. So the connection you have with your therapist is just really important at the end of the day, regardless of their, approach or modality. You need to feel comfortable with your therapist. You need to trust your therapist. It's just going to be hard to have a lot of progress if that stuff's not in place. That being said, that takes time. So I think it's really normal for your first, 1 to 4 sessions to feel a little awkward. In a way, it's like making a new friend or going on a date or something like that. You're meeting somebody totally new, you're both figuring each other out. It's going to take some time for the two of you to kind of find a groove. So, I've seen some people kind of hopping around saying, it was just kind of a weird session, and to some extent I think that's just a normal part of the process. That being said, if someone does something blatantly, really offensive, or totally crosses a boundary, that's a different story. But the relationship's really important, and that takes time to form. The 4th point that I would consider is that I guess a lot of this stuff kind of runs together, but I talked about there's not going to be quick fixes or like straightforward advice for issues. Knowing that sometimes things are going to get harder before they get easier. I see time and time again where people have been, avoiding, suppressing, running from issues, and that's, kind of a normal way to want to deal with things. That obviously wasn't really dealing with the issue. So when you come to therapy, this stuff we're facing it head on. So it can be really hard up front. And there are things we can do to kind of container that, but it's not unusual to feel like that it's hard work. I think the last point I had on here was getting clarity on like specific things you want to see change in your life. Again, a lot of clients will come to me saying like they have a very clear idea of what it is they don't want anymore. I don't want this pain. I don't want to struggle with my depression. I'm tired of struggling with my anxiety. And that's a really great start. But what we need to start thinking about, and this will actually kind of put you ahead of the game if this is something you're thinking about going into looking for a therapist or exploring therapy, is, okay, what is it that I do want? So if I did get a handle on my depression and anxiety, like how am I acting differently throughout my day? How am I spending my time differently? Am I engaged in new activities? Do I have a different job? Treatment should be driven by things that you can move towards, as opposed to just trying not to experience certain things. That'll get you stuck real fast. And I guess I'm coming up with points here on the fly, but the other thing when looking around is I just think don't be afraid to ask people, if you're calling or emailing therapists, like what their approach is. Don't be afraid to ask questions. There's so many different types of therapy out there, and it can be confusing for anyone in the market, for sure. But I guess know that your thoughts and feelings and how you feel towards a therapist are really important to the treatment process and should be considered when you decide to work with somebody. So I hope this information was helpful. Again, I know that this process can be hard for people, so if there's any other points along these lines you want me to hit on, or information that you feel like I missed out on, please let me know. I'd love to hear from you guys. Thanks.